More states commence second phase of vaccination as Anambra residents join in the inoculation exercise. Bauchi State faces vaccination hesitancy even as government continues citizens' enlightenment. UK Prime Minister Boris Johnson raises hope on ease of lockdown on June the 21st. Good evening and welcome to the COVID-19 pandemic update. I'm Kayode Okikulu. Well, Nigeria's test positivity rate may be low, but the NCDC is not carried away. And by extension, the agency is asking Nigerians not to get carried away as well. As at today, nearly 3,000 COVID-19 fatalities have been reported in Nigeria. Now, to prevent future deaths from this virus, the game plan remains simple. Take responsibility by protecting yourself and those around you. Well, there's a whole lot of interesting angles for you on today's program. But first, let's take a look at the figures.
After witnessing an increase in the number of confirmed cases in the previous 24-hour cycle, Nigeria has now recorded a relatively low single-day count of COVID-19 cases, with 17 infections reported from 5 states in the last 24 hours. Lagos had the highest figures with 8 cases. 5 cases were recorded in Rivers. Kano recorded 2, while Kaduna and Plateau had 1 case each. And a backlog of recoveries from Ondo State from January 31st till date. The latest tally raises the total number of confirmed cases in Nigeria to 166,534. Recoveries appears to have significantly increased as 1,154 persons were discharged after treatment in the last 24 hours, raising the number of recoveries to 159,935. There were no casualties since the last 24 hours, leaving the fatality toll at 2,099. Over 1.9 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while over 90,000 of those vaccinated with the first dose have now received their second dose. In the latest update by the National Primary Healthcare Development Agency, Benue State is taking the lead in the second phase of the vaccination exercise after vaccinating over 12,000 of its eligible population, followed closely by Katsina and Kano states. The World Health Organization has approved the Sinovac COVID-19 vaccine for emergency use, the second Chinese COVID vaccine to be approved by the organization. Globally, the number of confirmed cases stands at more than 171 million, while more than 3.5 million deaths have been reported from several countries.
So, for anyone who's been following the daily COVID-19 figures reported by the NCDC, you'll have seen that some states delay releasing their figures. Take Monday's cases, for example. The NCDC says it included a backlog from Benue and Nasarawa states recorded between February and May, which explains why the nation recorded over 200 cases for the first time in over 2 months. But there may be implications to this sort of staggered reporting of cases. Well, let's speak with Dr. Shalom Oni, a public health physician who joins us in our Lagos studio this evening. Dr. Oni, it's great to see you again.
Oh, thank you very much, Kari.
You know, I know it's quite important to have, the figures right in order to maybe get a sense of where we are exactly in COVID-19 fight. But over time, we've seen that some states have delayed releasing figures, seen staggered figures and the rest. I'm just wondering, is there an implication to this?
Well, Kari, for me, I'm shocked because at the core of the management of COVID-19 is a scientific approach. And when you're talking about scientific approach, you're talking about data. Everything comes down to data. So if you're generating data, or number one, if you're not generating data, it's a problem. 2, if you are generating data that are not qualitative, that's number 2. 3, if you are not releasing your data at the right time, to the central, then it becomes a problem. How are you going to monitor the trends if you are not releasing your data as at when due? How are you going to study the epidemiological pattern? Because what you do per day counts. It's not just what you do per week. So, for me, there are implications because this will cause a distrust among the public. Generally, there's this hesitancy all over. from the start of COVID-19. So when you're not releasing such a figure, of 28 deaths in a day, then it's a problem. So you're talking about distrust among Nigerians, you're talking about distrust from partners. What organization is watching, all other NGOs are watching and say, oh, what's happening? Is there something you are missing? Is there something we are covering up here? Everybody now needs to know. There will be doubt. There will be panic. Then it's a whole lot of problem, because you are unable to take, a timely scientific decision that will help the masses. You won't be able to report on time. So for me, I don't know what we could be from the other end. Could it be the current state of insecurity that's ravaging, some regions in the country that's affecting, the fear of kidnapping, the fear of, being robbed and things like that. And people feel they are not adequately protected. That could be a factor. Could it be a problem of funding from the other end? Or could it just be a lack of political will? The NCDC need to really dig deep and know what is really going on. We heard that they do have meetings with the states, state NDCD, SCDC. I don't know what to do at the state meeting. For me, if SCDC is having a coordinated daily review meeting, then there should be a sharing of data. So any state that is not coming up with their own data, that day you raise an alarm.
I mean, major issues you have raised. And looking at these figures, it might not be tricky to project, really, but still, let's look at those figures we have seen over time. How close or how far would you say we are to a third wave, looking at the trends right now?
For me, I wouldn't say we are close, and I wouldn't say we are far. But what are the things to keep on watching out for? We've just had the second wave. Second wave started November 2020, as far as I'm concerned. Because I work at the grassroots.
All right.
I lost somebody very close, even in the isolation center in November. So for me, second week kicked off, but we had an increase of second week of the manifestation in December. So it lasted till like January, February. But now, if you look at that gap, it confers antibodies on you 3 months, 4 months, 6 months. So from January, February till now, we are at the verge of a third wave.
Okay.
Now, that result we had on Monday is shocking. For me, I wouldn't want to take it with a pinch of salt. We need to dig deep. What exactly is that figure telling us? Are we beginning to see the rise of a second wave? Which I think we might be primed because our MPI is down and non-pharmacological intervention is down. You see everybody not wearing face mask. People are challenging you, why you wearing face mask? Somebody challenged me yesterday. Say, why are you wearing face mask? Is COVID-19 out there? Are you getting me now? So you hear a lot there. So
I wonder what you said.
Look at the story of India. Who would have thought that India will find themselves in that situation? So any country that is joking with MPI, it's inviting the third wave. So for me, either we are close or we are far if the signs are there.
You think it's inevitable?
For me, Nigeria is inevitable.
Well, Dr. Shalamoni, it's been a pleasure speaking with you on the one hand, but with those projections, I don't know what to say, but thank you so much for sharing your thoughts with us.
I'm always excited to be here. Thank you very much.
All right. Well, the second dose of the COVID-19 vaccination in Anambra State has begun with a strategy to conduct the exercise at designated health facilities with an average of 2 vaccination centers in every local government area. Well, the State Commissioner for Health, Dr. Vincent Opala, disclosed this during the flag off of the second dose at the immunization cold store facility at Chukwuemeka Odumegwu University Teaching Hospital in Amakoka. Well, he's asking all the 33,537 residents who have taken the first jab to make themselves available for the second dose before July the 10th.
To get COVID-19.
On March 11 this year, Governor Willie Obiano of Anambra State supervised the flagging off of the first dose of COVID-19 vaccination at the immunization cold store facility at Chukwuemeka Odumegwu University Teaching Hospital, Amakoka. He enjoined the people of the state to avail themselves of the opportunity to get the vaccine. 11 weeks after the first phase of vaccination, the State Ministry of Health says that 33,537 residents have been immunized, and this represents about 85% of the target population.
I want to encourage you that this vaccine will save your life from this COVID. I have taken this vaccine. I don't have any side effect.
I wish to appreciate all those who believed in us and presented themselves for vaccination, despite all the rumors and propaganda all over the social media.
The Executive Secretary of the Anambra State Primary Healthcare Development Agency explains that COVID-19 pandemic has ravaged the world.
It is hoped that this will increase the confidence of our people in the potency of the vaccines and yield a large turn-up for the next group of people to be immunized, the 50 years and above age bracket.
The representative of the World Health Organization in the state reveals that the exercise is fully supported by government at all levels.
This ceremony is no doubt going to send a strong and far-reaching signal to the entire Anambra that vaccination against COVID-19 is fully supported by the highest level of political leadership in the state.
As the second phase of vaccination begins, it's expected that the exercise will help reduce negative insinuations as well as fake news that surround the COVID-19 vaccine.
So almost a year and a half after the novel coronavirus hit the world, the question about its origin still hangs in the air, so to speak. Well, last week, the U.S. President Joe Biden ordered its intelligence agencies to conduct a 3-month investigation to unravel this. But a strong member of the U.S. Congress, Michael McCall, claims that the origins of the coronavirus pandemic are the worst cover-up in human history. Well, let's try to sift through what we know so far and why this may be important. We are joined by an infectious diseases specialist, Dr. Abdul-Jalil Tafawa-Balewa. He joins us from our Abuja studio this evening. Well, Doctor, thank you for your time on the program. Well, the WHO earlier commissioned this 4-week, it's great to have you, this 4-week investigation to Wuhan, China, where coronavirus was first detected. Now, some say that the report that came out didn't really have a lot of new information. I know the science community is somewhat divided on this, but for you, what more do you think we need to know about the origins of COVID-19?
One of the main problems I see is that we're looking at, the middle ground. That's in Wuhan. Dr. Chi and Dr. Chang that worked in the Winnipeg microbiology lab. Dr. Chi was a virologist and she was in charge of the vaccine program in Canada. Dr. Chang, Kadin Chang, was also a biologist, a prolific writer, worked on HIV, E. coli, and so many other things. Now, they were expelled from Canada not long ago because of the shipment of very infectious pathogens, Ebola, which Dr. Chi made ZMapp, which is a treatment for Ebola. Nobody is looking at this at the moment, but the Canadians have woken up. It was in 2019 when some pathogens were shipped from this particular lab in Winnipeg, Manitoba, to Wuhan from one level 4 lab to another one. And Dr. Chi had been going back to China since that time for 2 weeks at a time, teaching. She also has Chinese students coming into Canada and she's teaching them. How come nobody has traced anything to that route so far? If you say Ebola, for instance, is a bat corona type virus, we have so many coronaviruses all over the world, but no corona has ever been found in bats, for instance. This was attributed to bats also. But I think that Dr. Kadin Chang and Dr. Chi need to be better interviewed to get to the origin of this.
And how you have maybe put another peg in Canada, but now that this investigation has been ordered by the U.S. president, are you optimistic that anything new might come up? I mean, not considering the issues you have mentioned in Canada, but with this investigation, are you optimistic?
No, the surveillance system that we have in the United States is the best, bar none. They will get to the bottom of it. I'm sure.
Well, so much to discuss on this, really, but Dr. Abdul-Jalil Tafawa-Balewa, I would like to thank you so much for that insight. I mean, about 2 months and a few days to get the result of that investigation. So hopefully we'll be discussing this at that time as well. Thank you so much for your time.
Thank you for having me.
Well, let's go on a break now, and when we return, we've seen super spreading in India, and now that the UK is planning to eventually remove all lockdowns by June the 21st, what are the odds that maybe this might go down south? We'll discuss this in a moment. Please stay with us. Welcome back. Bauchi State has slowed down testing, and it appears the state is now focusing more on administering the COVID-19 vaccine. Well, the executive chairman of the Primary Healthcare Development Agency, Bauchi, has been speaking about some of the challenges of administering the COVID-19 vaccine to some sections of the population. Well, he's particularly concerned that some people are still opposed to taking the jab.
Right now we are in UNICEF. We went to NYSC. Most of the corpers refused the vaccination. Out of 1,200 corpers, only 48 were able to receive the vaccination. They refused. I think it's the rumor in the social media that is blocking the matter. And I want to tell them that all of us that we took the first and second dose, we have not got any reaction in Bauchi, except my reaction. I heard that there was a lady that they gave her vaccination, she fell on ground. And while we don't vaccinate standing, not because of anything, because of the pain, not because of the COVID-19 vaccination. And most people that have reaction, we are not informed. We are supposed to be informed that there is a reaction so that there is antidote to all the reactions. And every one of your journalists have reacted, and he didn't tell us. And it was no good. We want to inform the public that we need to know if there is reaction. We also realize that even if you are vaccinated in Lagos or Kano, you can take your second dose in Bauchi. There's a form we fill, and then we scan the thing. It will just go into the database of the National Primary Healthcare. We are also appealing to some people, particularly the people that are going to Jerusalem for pilgrimage. There are 170. Only the official received the vaccination because of the rumor.
Let's move outside Nigeria, where we've seen super spreading events in India, with a single infected person infecting many others in a short time. Now, almost all of these infections have happened indoors and involve large groups gathered in poorly ventilated spaces. Clearly, there is a need to pay attention to ventilated spaces. So, what was we begin to do to ensure cleaner air, and can every business afford this as people return to mixing at work, dining at restaurants, and others? Well, the United Kingdom is currently transitioning through eased restrictions with plans to lift this finally by June the 21st. Well, Dr. Douglas Iyala-Pepple is a GP specialty registrar who joins us from the UK. Well, first, let's talk to the latest figures coming out of the UK. No death was recorded across the UK yesterday, but then that joy was short-lived with 12 new deaths today. Well, the last time the UK recorded over 10 deaths was over a week ago. So how are you interpreting these figures?
Hello. So thank you for having me. So to be honest, I think for yesterday it was quite a very impressive news talking about the zero rate of death from COVID-19. It was quite celebrated, and we thought maybe we'll move in from the conversation where we're talking about infectivity and death rate up to, you know, vaccination rate and even to immunity rate, which should be the peak of the whole conversation. But unfortunately today we registered a number of deaths as well. But I think in general, it seems like the UK is gradually coming out of, you know, the effect of COVID-19 with the ease of lockdown. However, obviously there has to be caution, and even though people have been optimistic, but like the Prime Minister said, it's a time to be optimistically cautious, and that's what everyone should be doing at this point.
You know, it's quite a challenge because a lot of people are excited that at least there's some measure of freedom. So it might be quite tricky when it comes to being optimistically cautious. But let's talk about the Prime Minister's confidence that lockdown will be lifted finally in 3 weeks. Some are advising the government that there are signs that the UK is in early stages of another wave, so they think there should be another lockdown. The talk about being optimistically cautious and there needs to be another lockdown. Where do you stand in this continuum?
Yeah, so the thing is, the reports of the scientists is something that doesn't really spell doom and gloom. Depends on the interpretation anyways, and the Prime Minister, I believe, is handling it very, very diplomatically. He has come out to say there is no need for people to become maybe apprehensive now. The roadmap to easing the lockdown hasn't changed, although the report from the scientists is a bit of, a snapshot of based on information they've gathered at the point. So it's just for people to begin to take extra responsibilities. And if you look at the statistics in the UK, for instance, a country of about 60 million people, you've got about 40 million already having the first dose of the COVID jab, and about half of the population having the second dose of the COVID jab. So it means we're getting to the level where we have a better form of immunity, I would say, especially protecting the vulnerable and even the health workers. So that brings us close to the point where we can internally fight against the virus, and life can actually return to normalcy. So talking about, third wave, I think if we go ahead with what we're doing so far, it's possible that we can avert that possibility.
Well, possibilities, and I like that you choose the bright and positive one. But I'd like to thank you so much, Dr. Yala Pepul. And that message about being cautiously or optimistically cautious is quite important. Thank you so much for your time.
Thanks for having me.
Well, the UK government's vaccine task force says latest coronavirus data in the country looks encouraging. But there needs to be a balance to the discussion on ending restrictions by June the 21st. The UK announced 0 deaths yesterday for the first time since the pandemic began. And the Prime Minister believes there is nothing suggesting that lifting lockdown cannot go ahead. Well, here's more on our COVID-19 pandemic update.
You had 7 or 8 of the same person?
The UK Prime Minister Boris Johnson says he will be cautious in lifting coronavirus restrictions. However, it's still unclear how protected the population would be against the new surge of COVID-19 cases should lockdown end as planned in June. Mr. Johnson had previously warned that the swift spread of the B.1.617.2 variant of concern, first identified in India, England's COVID-19 restrictions on the 21st of June. Today, he seems sure that would not happen.
I can see nothing in the data at the moment that means we can't go ahead with step 4 or the opening on June the 21st. But we've got to be so cautious because there's no question the ONS data of infection rates is showing an increase. We always knew that was going to happen. Don't forget, we always said that the unlocking steps that we've taken would lead to increases in infection.
Stretching several blocks outside the facility. Places like Kadrin have been a driving...
Across the pond to the United States, the total number of confirmed COVID-19 cases has surpassed 33.28 million, with the death toll exceeding 595,000, according to the Center for Systems Science and Engineering at Johns Hopkins University. The United States still leads the world in the number of COVID-19 cases and deaths. Meanwhile, India's COVID-19 tally rose beyond 28.3 million cases today, with 132,788 new cases reported in the past 24 hours. Compared with the record of 414,188 new confirmed cases in a single day reported on the 7th of May, India's daily increase in confirmed cases has dropped significantly, with the growth rate down by nearly 70%. The number of daily active cases has been on the decline over the past few days.
Don't forget to protect yourself. The virus is still out there, so continue to take responsibility and visit our websites, channelstv.com, for more updates and a better understanding of the pandemic. We also have all the big stories from politics to business, sports, and so much more, all at your fingertips. So that's the COVID-19 pandemic update for today. Thank you for watching. I am Kayode Okikiolu.